Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report on the Anterior Cruciate Ligament. Please feel free to visit my website, championshipchiropractic.com, where you can get additional information on the book and you could connect with me on other social media platforms. Please enjoy this sports medicine video. On today's episode of Dr. Ozello's Sports Medicine Report, I'm going to discuss the anterior cruciate ligament, or in abbreviations, it's often called the ACL. We hear about the ACL in the news all the time. This is a serious injury. This is an injury that can be season-ending and career-threatening. It can be from a traumatic impact or it can be from a non-contact onset. So I want to go ahead and explain to you exactly what the ACL is and give you a good description of what it does so you understand exactly how you can help yourself to prevent this injury and to rehabilitate this injury. An injury to a ligament is called a sprain compared to an injury to a muscle, which is called a strain. Ligaments connect bones to each other and help to stabilize and support the joint of those two bones. Ligaments are connective tissue made of tough collagen fibers. Like I said, they stabilize joints by preventing excessive motion in those joints. That's how they stabilize the joint. The anterior cruciate ligament is a knee ligament. It is what is called intracapsular, meaning that it is deep within inside the joint and it is in the capsule of the joint. The anterior cruciate ligament is the main knee stabilizer. It helps to prevent excessive anterior translation of the tibia. The tibia is the big bone in the lower leg and the femur is the bone in the thigh. It helps, the anterior cruciate ligament helps to prevent excessive anterior translation. Say this is the femur right here and this is the tibia. It helps prevent that tibia from moving too far forward. So it supports the joint and stabilizes the joint by preventing excessive anterior translation of the tibia, and it also helps prevent excessive rotation of the tibia on the femur. The anterior cruciate ligament begins on the femur and it begins on the lower aspect of the femur inside the knee joint. It runs inferior, it runs medial, meaning it goes towards the center, and it also runs just a little bit anterior and it connects to the top part of the tibia bone. Where the anterior cruciate ligament attaches to the tibia, it blends with the medial meniscus. Now this is very important, so I want you to remember that. It blends with the anterior horn of the medial meniscus. The anterior cruciate ligament has two major bundles, the posterolateral bundle and the anteromedial bundle. The posterolateral bundle is tight when the knee is extended and the anterior medial bundle is moderately lax when the knee is extended. When the knee is flexed, the anterior medial bundle is tight and the posterior lateral bundle is lax. The anterior medial bundle, often abbreviated to the AM, is the primary restraint against anterior tibial translation. That's what I was speaking about before, about the tibia moving forward or anterior on the femur. The posterior lateral bundle, often abbreviated to the PL, that helps to stabilize the knee when the knee is in extension and especially against rotatory loads, which is the rotation of the tibia on the femur. An injury to the anterior cruciate ligament is extremely serious. This can be a season-ending injury and it can be a career-threatening injury. An injury to the anterior cruciate ligament, it can be isolated or it can occur with injury to other structures. O'Donoghue's triad, often nicknamed the terrible triad or the unhappy triad, is when there's an injury to the anterior cruciate ligament, the medial meniscus, and the medial collateral ligament. The anterior cruciate ligament can also be injured with a posterior lateral corner injury or a posterior medial corner injury. Like I stated before, is the injury can be, the onset can be traumatic or non-traumatic. And surprisingly, non-traumatic is more common than the traumatic onset. Non-traumatic is more common in younger athletes, and also this injury, the non-traumatic form, is more common in female athletes than in male athletes. It can happen in every sport. Usually the mechanism of injury for a non-contact ACL injury is that it occurs either during a jump, landing, when the athlete is landing from the jump with a quick deceleration or a quick acceleration, or from a quick directional change, what we call cutting. When the injury occurs, the athlete may feel a rip, a tear, a pop, or a crack. Most of the time they're going to feel instant pain and almost immediate instability. There are 3 grades to a ligament injury. There's grade 1, which is mild, grade 2, moderate, and grade 3 is severe. In grade 1, there is microscopic tearing and stretching of the ligament, but the ligament is intact. There's going to be some mild swelling. There's going to be pain when you are when a doctor, a medical professional like myself, is testing the integrity of the joint. There's going to be a firm end point, meaning that you can feel that that ligament is still holding those bones in place, still stabilizing the joint, but that there is obviously injury to that ligament because of the pain and because of the swelling in that area. In a grade 2 is the moderate form, meaning that there is partial tearing. There's going to be pain, there's going to be swelling in that area, very limited motion, some instability in the joint. When the doctor is testing it, there will be excessive motion in the joint. In most cases, there'll be excessive motion, but there should still be a pretty firm endpoint because the ligament is not completely torn. And then in a grade 3, like I said, that is severe. The ligament is completely detached. The ligament is torn into 2 pieces. When this occurs, first of all, like I talked about with the other ones where there's a firm endpoint, there's no firm endpoint. The tibia can be moved on the femur, and when you get to that endpoint, it's kind of soft and the doctor can really feel that. In this one, surprisingly, because of the seriousness of the injury, the pain is not as great as you would think that it would be. There's still going to be a large amount of instability. Prevention. During almost all of my Dr. Ozello sports medicine reports, I speak about injury prevention. And I say this every time. Injury prevention is easier, faster, and less expensive than injury rehabilitation. Now, obviously the contact onset, that is really tough to prevent when we're in any type of contact sport. But the non-contact onset of an ACL injury, you can do things that can help to prevent this injury. What we want to think about is how the ACL works and what it does. Okay, it prevents the anterior translation of the tibia on the femur. So we want to strengthen the hamstring muscles because they help to prevent that motion. They help to control that motion. When the hamstrings are working eccentrically, meaning that they're working in their negative fashion, they help to prevent forward motion of the hip and of the thigh, because when they contract concentrically, they do the opposite motion. So strengthening the hamstrings is vital in preventing this injury. There have been studies done that when an athlete lands from a jump and gets the ACL injury, that many times their tibia is moved forward of the femur when they land. So the hamstrings are not firing either at the same time or quick enough as the quadricep muscles, or they are weak and the tibia is being pulled forward, so the athlete lands in a position where the ACL is already stretched and that injury occurs. And the same thing can happen with the cutting, and the same thing can happen with a quick acceleration and a quick deceleration. So you want to strengthen your hamstrings. Another thing that you want to do is strengthen your core muscles, especially the gluteus medius muscle. This is an extremely important muscle because it helps to function to stabilize the pelvis and keep the pelvis level. When someone is cutting or someone is speeding up or slowing down, their pelvis is moving up and down when they're running. We want to limit that motion as much as we can. So strengthening the core muscles, especially the gluteus medius muscle, is going to help to keep the pelvis level. When the pelvis is up, say that this is the right side of the pelvis is up, that hamstring is being stretched. So the athlete makes a cut, or obviously a cut is a nickname for a quick change of direction, or they decelerate or they accelerate, and that hamstring is stretched. That's putting the hamstring in a weak position so it cannot support the knee the way that it should. So we want to strengthen the gluteus medius muscle. Also, you want to do proprioception training. Proprioception training is when you work on an unstable surface. So use things like the wobble board, the rocker board, the Bosu ball. Those are all unstable surfaces, and even the fit ball, that are going to help you to improve your proprioception. Proprioception is the body's awareness of where it is at in nature. Improving proprioception helps prevent a wide range of injuries, including the anterior cruciate ligament. So you want to strengthen your hamstrings, strengthen your core, especially the gluteus medius. You want to improve your proprioception by training on an unstable surface. Also, you want to strengthen the entire kinetic chain from the feet all the way up to the spine. Strengthen your feet, strengthen your ankles, strengthen your knees, your thighs, your hips, your spine, your core. Make sure that there are no weak points, because if there's a weak point, that will not be able to carry the load, and it's going to increase the demand on another area, and that area may be injured. So you want to keep this in mind to help to prevent an ACL injury. Some other things that you want to keep in mind when you're training that are going to help to prevent an ACL injury is to do single leg exercises. When we are training, often we're doing double leg exercises, and they're great exercises. They're, most of them are multi-joint functional exercises, which you want to do, but you can do single leg exercises also, and that's going to help a great deal. Things, if you are advanced and you can do pistols or one-legged squats, whatever you want to call them, those are going to help to strengthen the entire kinetic chain. Also doing eccentric exercises. I had mentioned eccentric before. Negative contractions are eccentric exercises. If you are an advanced trainee and you have strength in your hamstrings, you can do eccentric glute ham raises, which are a fantastic exercise to strengthen the hamstrings and the glutes. Then also you can do explosive exercises. Those are going to help you a great deal. Your jumping exercises, you're jumping forward, jumping backwards, jumping side to side, jumping onto a platform. Those types of things are going to help to strengthen the muscles and the joints. Some other tips on preventing the ACL injury. When you're doing any type of training, you want to prevent what is called valgus collapse. Valgus collapse is when the knee moves inwards and the knees are no longer in line with the toes. The knees over toe position is a correct position when we're squatting, when we're lunging, when you're running, and that means that your knees and your feet are in line with each other. So you want to concentrate on that. I have seen many people at the gym, they have a tough time when they're doing squats or they're doing cleans, and they may have a valgus collapse. So you want to strengthen muscles that are going to help to prevent that. Also, working on the unstable surface, things like Bosu ball squats, is a tremendous, it's an advanced exercise, believe me, but it's a tremendous exercise for strengthening the entire kinetic chain and helping to prevent a valgus valgus collapse. If you do Bosu ball squats, trust me, if you have a weak point, you will find out immediately when you start to do Bosu ball squats. Also, when you are landing from a jump, try to land with both feet and try to land on the forefoot, on the balls of your feet, and roll backwards. You want to practice this when you are doing your explosive movements, when you're doing your training, so that when it happens during a competition or an intense training, that your body is used to landing that way. So it's going to help you to prevent the ACL injury. If the ACL injury does occur, you have to be mentally strong. You have to be mentally prepared. You're going to need to be driven and determined and focused to rehabilitate from this injury. Read articles about athletes who have recovered from this injury and continued to excel. Read about what they did and how they did it and what their mindset was, and it's going to help you a great deal. It is very important to believe in yourself and believe how bad you want it, because you're going to recover from this injury if you work hard enough and you are persistent and determined. Like I said, this can be a devastating injury, but do everything you can to prevent this injury. But if it does occur, get your proper treatment. You may need surgery. You may need to see other types of doctors. Get testing done, get the MRI done, find out exactly what's going on, get your correct diagnosis, and get that treatment. As a doctor of chiropractic, I have seen patients who have ACL injuries. Adjusting their spine and their hips, their feet and their ankles helps a great deal for them to strengthen the entire kinetic chain and get them working properly. You can work with a strength and conditioning coach. You can work with a physical therapist. You can work with a rehabilitation specialist. You can work with a doctor of chiropractic. Figure out who you want to work with. Find that right person. Be persistent. Listen to what they tell you. Ask as many questions as you can to find out as much as you can and educate yourself as to what you can do to recover fully from this injury. You want to restore the motion in the joint. You want to increase the stability in the joint. When you start with your rehabilitation, it's going to just be some isometric exercises and some range of motion exercises. All the exercises will most likely be non-weight bearing exercises. Then you're slowly going to progress to weight bearing exercises and strengthening exercises and proprioception exercises. But you can do it. Do everything that you possibly can to educate yourself on how to recover from this injury. And like I said, read about other athletes who have recovered from this injury, come back from this injury, and continued to excel. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report on the Anterior Cruciate Ligament. My name is Donald Ozello. I'm a doctor of chiropractic. My office is located in Las Vegas, Nevada, and is called Championship Chiropractic. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you again for viewing today's episode. If you like today's episode, please give me a thumbs up. Also, please feel free to leave any feedback, suggestions, or questions in the comment section below. If you have additional information that you have used to prevent this injury or rehabilitate from this injury, please put it in the comment section so we can help other athletes. Always believe in yourself. That is the most important thing. Believe in yourself. Train hard, train smart, stay injury-free, and accomplish your goals.